I do believe that Speaker Ryan, along with President Trump, they recognize the critical moment, which is now, to repeal and replace Obamacare. They've had this, obviously Speaker Ryan has had his better way provisions in place for years, so this should not come to no surprise to Republicans. Of course, that this is just the beginning of the legislative process. This is part of when you have conservatives being vocal in terms of what they don't agree with, and this is why you have to let it go through the process. There will be amendments to the bill, and as well as what we're seeing, for example, with, let's say, the Republican study committee. They're conservatives. They're coming out saying, look, if you freeze Medicaid, if you do a partial refundable tax credit, we could agree to this. So I think you're going to see a lot of room for compromise, but I think this is a time that everyone should voice their opinions, and you have to realize, Shannon, they have to get this process moving. They've got to get it done because time is just so limited.
Well, Matt, there are some who say, why not slow down and wait for that CBO score from the Congressional Budget Office? We're expecting now it's probably going to come out Monday, but it's critical to find out what will happen to coverage, how much this is going to cost. I mean, those are important things before people get to voting on it.
Totally agree. I think it's a very fair concern for people to say, I don't want to vote for something until I know what it costs. I also think that Speaker Ryan and his team are very confident that that CBO score will show that this Republican alternative costs much less money. But the fundamental philosophical question here that Republicans are wrestling with is the following. Is it about health care that's the best on the globe, that's affordable, or is it about a health insurance program that covers all Americans? And I think most Republicans are more concerned about having affordable health care that's the best on the globe, and that Obamacare is threatening that. This is a basic philosophical question they have to decide. If they decide to cover as many people as possible, or as many people as Obamacare did, it won't be much cheaper, and I think it really violates what the message from the voters over so many of these elections, which is we want a completely different path. So I think the idea of completely repealing Obamacare makes sense, and having a replacement. And now we're having that debate of what that replacement will look like.